There's between 14 and 16 million patients every year who really should have some sort of evaluation for osteoporosis. Only about 2.5 million patients a year have been able to get these scans. I'm a diagnostic radiologist, and I trained at University of Michigan in Ann Arbor and spent 2 years at Naval Hospital Long Beach, essentially doing radiology, and actually was the section chief of ultrasound at that time. I had spent about 20 years in private practice in San Francisco in diagnostic radiology and ultrasound, and then got very interested in administrative medicine. And took a Master's of Public Administration and Health Services at the University of San Francisco, and then got involved in imaging management and in the utilization of diagnostic imaging. Why did I become interested in osteoporosis and Bindex especially? But I had an interesting run-in with osteoporosis myself. There's 4 glands that surround the thyroid gland called the parathyroids, and they control calcium metabolism. And out of the blue, I developed a small adenoma, a small benign tumor, which actually drove my calcium down, and I actually had to undergo the scans and the treatment for osteoporosis for about 3 years. In peripheral ultrasound, previous technologies really did not have a high sensitivity. And so if you're only going to be able to detect 20 or 50% with accuracy of the people who would have osteoporosis, or conversely the people who didn't have osteoporosis, it's sort of like flipping a coin. The gold standard in osteoporosis in determining the bone density or bone mass is the DEXA scanner. But the DEXA scanner is usually located within a hospital or a large medical facility. And so one of the biggest barriers has really been that exactly, getting to them. And the days of COVID, where you can't go into these institutions now, or patients are afraid to go to hospitals or large facilities because of other patients who might have COVID, there really is an access issue to just ease of access. Also, if someone goes to take a DEXA scan, they have to go in and sign into a facility. They have to disrobe, get on the machine. The examination takes maybe 15 or 20 minutes, but by the time they go through all of the rigmarole of getting set up, it's a 1 to 2 hour event, much less the travel time to get to the institution that has it. For the patients that have had a fracture, oftentimes they're immobilized. It's very difficult for them to get into a big institution to get a DEXA scan. What's very intriguing about Bindex is its reliability, its sensitivity, and its negative predictive value. And these numbers are very, very high and represent a real sea change in peripheral ultrasound. What Bindex does is it actually measures the cortical thickness rather than other machines which measure the through transmission of ultrasound. By relating that cortical measurement in the tibia actually to the situation at the femur, it really does, and actually the situation at the hip, it really does predict those patients who would be at risk for fracture. The Bindex machine is extremely portable and could go anywhere. And the thing that I'm especially excited about Bindex is the equipment is quite simple to use and quite foolproof in terms of getting the measurements. The DEXA machine requires a technician, a certified technician, to perform it. The Bindex scan can be performed by anybody. The technique is really a matter of finding the right place to put the scanner, and there's a very good device that comes with the equipment that actually measures based on where the central part of the knee is, the correct part of the tibia to put the scanner on to get the best measurement. The software package in it has a lot of protective stuff so that basically it won't accept a bad reading. It makes 5 measurements somewhat automatically, and if the measurement is not correct, it won't accept it, and the technologist couldn't go on, or the medical assistant can't go on until the probe is properly placed. Bindex reports are very easy to interpret. They basically come out as a number figure, but also Um, the patients show up on a large bar or column which has a green area, a yellow, and a red area. And you can immediately look at it, and if a patient is in the green area, there's no further issue. They do not have osteoporosis. On the other hand, if they're yellow or red, they need further evaluation, and those are the patients that you want to identify and send on for further evaluation. And the other patients, of course, in the green area, you're just reassuring them. Because it's so easy to do and so straightforward, it has a lot of appeal in terms of its ability to screen large numbers of people as they go through a normal flow of seeing their doctors. Before the doctor sees the patient, the medical assistants are certainly taking measurements like blood pressure and weight, height and weight, and this sort of thing. And at the same time, they could be doing a Bindex measurement. Once the patient goes in to see the doctor for the physical examination and everything else, the doctor's got that information. Anything that's out of the normal flow would be very difficult for them to do and to accommodate. But I think Bindex could easily be accommodated right into that front-end evaluation of the patient without changing very much the doctor's scheduling or interfering really with the office scheduling and office functioning really. It's very acceptable because you don't have to disrobe for it. It's totally a comfortable procedure. Because it's being performed while the patient is sort of watching the technician do it, or the medical assistant do it, the patients get interested in it and totally not bothered by it. So I would say it has very broad patient acceptance. And then they're, of course, very interested in the result. And the fact that the result is coming on real time is extremely helpful. There's no anxiety for the patient because the patient's going to know right as part of that very visit whether there was any issue or not. The thing about Bindex that's really wonderful is it's low cost. And so the physicians' offices that can do Bindex can have a very positive response from direct billings of the patients. And that's a payment of $30 or $40. I think most patients would really be willing to pay that. Again, it helps the practices themselves because the primary practices tend to be rather poorly reimbursed for many of the things that they do. So as a revenue generator for the practices itself, there's a certain appeal to Bindex. Large medical groups, the Medicare Advantage plans, people who are going to be interested in value-based care are all going to be very interested in what Bindex can bring to the table. Medicare has various measures to try and determine quality, and they are called HEDIS measures. And two of the HEDIS measures that are very important are measuring a plan's ability or a group of physicians' ability to see a patient population and to adequately screen that population for osteoporosis. A plan that has higher star ratings actually gets more money from Medicare for taking care of its group of patients. For a Medicare Advantage plan to increase its star or quality rating by fulfilling the HEDIS measures of screening a large portion of its population, this is a great appeal and very significant to the plans themselves. About 54 million Americans have osteoporosis and low bone mass, and 50% of women and 25% of men over 50 will break a bone due to osteoporosis. Osteoporotic fractures account for more hospitalizations than breast cancer, diabetes, and myocardial infarction combined. So it's a huge element of what can happen to people as they age. There's something like between 14 and 16 million patients every year who really should have some sort of evaluation for osteoporosis. But really, because of the difficulties in number one, the number of scanners to do it, and the location of the scanners, because of this, only about 2.5 million patients a year have been able to get these scans. That leaves an awful lot of people who can't be identified as having an issue with osteoporosis and really needing therapy to avoid fracture. I was very impressed in learning about what Bindex has done worldwide but that also really over 1 million scans have been done in the United States. Many of the problems that would have occurred if there were technical issues or other issues, those problems have been identified and really solved. So that for deployment of Bindex in a widely or in a total population kind of thing, it's already been roof tested. It's kind of doing well by doing good. In addition, it would identify a large number of patients who would, number one, not have to worry about osteoporosis, which virtually every woman at the age of, after the age of 65 does have to worry about. The idea that you could widely diffuse this and identify all of these people who potentially are going to get into trouble, who would never have any idea. That really is the promise of Bindex, to be able to accurately, in a very easy fashion, as part of their normal physical examinations, identify people and get these people, the ones that need treatment, to treatment.